Session 3 and 4 taught by Dr. Reams and Black in 1977. Thesis Tape 9 Side A.
Tuesday, 10 a.m., June the 28th, 1977, Session 3 and 4, Dr. Reams, Biological Theory of Ionization, Murrieta Hot Springs Resort, Murrieta, California. Dr. Carey Reams speaks on over and underweight. Dr. Black continues his theology on eyes. Tape number 8-6/27/7/1-77.
Took the minerals, but did not do what they were told till about 2 or 3 days before they got back to you. And then they really got on the program. When they got to you, they said, "Doctor, I feel worse than ever. I feel like something that cats drug in couldn't eat. This diet is killing me." They think you don't know that for 26, 27, 28 days that they haven't done anything about it except take the tablets, expecting those tablets to perform a miracle. And they haven't taken their water systematically. They haven't done anything. And you say, "Well, I see that you feel badly because you only started 2 days ago or 3 days ago or 1 day, and your body's in withdrawal. Why didn't you start whenever I told you to start?" "Well, Doctor, you're kind of right about it. I just got too busy and I forgot about it till 2 or 3 days ago, and then I got on the program." "Well, your body's in withdrawal. It's changing from one zone to another now, and you keep it up, and then I want to see you in a week. 1 week I want you back here. And I want you to do everything that you've been doing for the last 3 days. Now, in a week, they'll come back, and let's see what will probably happen. For instance, then you will find that they probably have a 1.8 that they've really done. Now, it can be anywhere between 1 and 2. It can be anywhere between 1 and 2. But you'll find that this top number is probably dropped from 700 down to about 660. The lower the energy, the greater the change. And you'll find this bottom number is picked up to maybe 620. And you'll find that the salt has dropped down to about maybe 10, still a 4M. And you'll find about an 8 over possibly a 10 or vice versa. In other words, about an 18 reading is what you should expect there. A little higher wouldn't be any out of order. Yes? Sir? Is that all right? Okay. 8 over 10 there. 8 over 10. What I tried to make. Well, why would that urea increase? That's a good question. Why would it increase? That's right. It's throwing off the old cell, and you can also expect a weight loss for about a week in this case, because it's throwing off the old cells faster than it can rebuild the new cells. So it's nothing unusual for them to lose a little bit of weight, even those that think they can't afford to lose any. And now, let's suppose that this person was overweight, like we said to start with. Suppose that they were, we'll say, 100 pounds overweight. I just picked a number out of the air. Well, and they were on a 6-day fast, and then 3 days of light diet, I mean very light, and another 6-day fast, and then three more days of light diet, and then back to a diet that would fit their body chemistry. Now, they will lose possibly 20 to 30 pounds during that 12 days of fasting, anywhere between 20 and 30 pounds. Then you put them on a diet, and they're going to gain it all back, and probably 6 or 8 more pounds. Now, you must tell them this, and then after that, it will begin to drop off slightly until the body weight drops to its genetic level. Now, why would it put it all back on and then a few extra pounds? what would cause the body to do that? I'll tell you what would happen here. The muscle is 400 times heavier per given cube than fat. So the muscle will form faster than the fat is released. It will look like they're losing weight, even though the scale says they're gaining weight. Yes, a person, whenever you put them on the 12-day fast, will lose between 20 and should lose between 20 and 30 pounds of weight. And then when they go back on their diet that you give them that fits their body chemistry, they will put generally all the weight that they had back and add 6 or 8 or even up to 15 pounds more weight than they had to start with. The reason for this gain above their original weight when they started it was that the muscle is heavier than the fat, and the muscle tissue is developing much faster than the fat is being released, because the muscle is 400 times heavier per cubic inch than fat. Unless you tell them that, whenever they gain this extra weight, they're going to feel that they are going to be the world's fattest woman or fattest man, and it frightens them very much. So you need to tell them what's going to happen before. One more thing I'd advise you to do in counseling people is do not spend over 15 minutes with any one person counseling them at one time. Limit it to 15 minutes. They may have 1,000 questions to ask you, but limit it to 15 minutes, and then they'll come back. But if you tell them everything they know, they're not going to come back because they'll do it themselves. Yes? We're coming to that one. I was just taking the overweight. Now we'll take the person that's underweight. No, it looked like they're losing weight. No, to the person that's overweight, it will look like that they're still losing weight. Their figures begin, if it's a woman, it's beginning to get more like a Coca-Cola bottle again. It's beginning to take some shape, and the first thing you know, they'll be probably, if they have small bones, small feet, small head, they'll be out of the half size when they buy their dresses and clothing. But if they have big bones, big head, big joints, big feet, just big people, then forget about your weight chart. But don't forget about the fat. Be sure that it's muscle instead of fat. And another thing to do for the fat person is to have them walk. Do a lot of walking, because in the fresh air. Now they may say, well, I walk 50 miles a day cleaning house and washing dishes and cooking meals and tending to the children. Or the husband may say, well, I'm on my feet all day. It still don't make any difference because you're under stress. You need to walk when you're not doing anything but for the joy of walking. And it's a very good idea when you're walking, either alone or with someone, to see how many things you can call their attention to that the other one didn't see. It's also a good idea when you get back to your house or your home, whichever it is. There's a lot of houses that's not homes, and there's a lot of homes that's not houses. They're just little trailers, cardboard castles. And God bless the cardboard castles. I love them very much. But whatever you call your home, is to sit down then for 30 minutes and more or less quiet and meditation and write down the most beautiful things that you saw on that trip. And it will improve your memory terrifically. And it will open your eyes to the wonderful things that God has made. And you begin to think right. You begin to enjoy life. The first thing you know, you're going to catch yourself singing as you work or humming. Now, it's wonderful to sing, but there's nothing It's not necessary to carry a tune, but to try to sing. They know chickens sing, but they can't carry a tune. They sing discords all the time, but yet they sing, they're happy. And a singing hen is a laying hen. Unless the hen is laying eggs, she doesn't sing. And those chicken tone voices. So happy people are people that sing and rejoice. So what I'm trying to say, if you're overweight and you're self-conscious of it, then you're miserable and you can't sing and you don't breathe deeply enough. So I would like to see this old-fashioned song fest come back. And I would like to see people do more singing or whistling, but I have been told that a whistling woman and a crowing hen will sooner or later come to some bad end. An old proverb. Well, that's not exactly true. Just so you breathe to the depth of your lungs. So learn to play a musical instrument. But learn to enjoy life and let your face know about it. And smile. Now is there anything else anyone wants to ask about overweight? Yes? It's the urea. If the urea is above 24, be very careful about putting people on lemon water until it gets below 20. Well, if it's both 20, then I'd go on water one day first and then start on the lemonade. Well, that all depends. If they're over 35, I'd be very careful, but under 35, you need not worry too much about it. Yes. Now, but the urea, pay more attention to the urea than you do the urea height than you do the saline until it gets above 45. That's when you really need to be concerned. Well, that's right. That's for precaution's sake. If they're over 35, be very careful about it. But then you put them on water one day and then the lemon water. Because in one day it'll bring it down below 20 and you'll be perfectly safe. Or if you're in doubt about it, have them come in the next day and remeasure it again. Or if you're in a lot of doubt about it, send them to a retreat. But you generally don't have this problem until you get above 35, before both numbers work hand in hand to cause a mild heart attack. Of course, we don't want anyone to have any kind of a heart attack. Let's take up the underweight now, the people that thinks they can't lose any weight at all. We will take a person who will say that's 5 feet and 6 inches tall, or 8, and that they weigh, a female would weigh 90 pounds, and a male would weigh 120 pounds, which is quite low. The thing about it that you want to ask at this stage, have you lost any weight in the last 6 months, or the last 2 months? This is the question you want to ask. And they said, no, I haven't lost any weight to amount to anything. It goes up and down a little. Then it's safe to put them on the lemonade and water. But if they said, I have lost a lot of weight in the last 6 months, 30, 40, 50 pounds, 20 pounds for a woman or more, then I would say that would be a retreat case, because their energy level would be quite low, and you'd almost have to test them every day to keep them from going comatose or losing consciousness. In other words, the lower the total energy level reading is, the more unpredictable are these numbers. The higher the energy level is, the less change that they make in it. However, if you had a person that had lost weight quite heavily for the last 6 months, you would have a little different reading from what you would have here. That is, after the first week, or even the first test. The sugar probably would be the same in either case, but the the pH would possibly be about a 520 over possibly 550, and the urea would be possibly a 12. There's two things that a urea could very easily be here. One could be a 12 over 8, or in that category, vice versa, or it could be a 6 over 4 of opposite in that range. Now, in the first case, it means that the person's energy is quite low. In fact, if the person was under, say, 45 years old or 50, the energy rating would be about, somewhere around 30, close to it. I haven't gotten all the facts in here, and here, and here to know exactly, but somewhere around 30. Now, if they were over, we'll say 60 or such a matter, yes, over 60, then the energy would be probably 18 or 20. Now, why would it be lower on the same numbers at 60 than it would be at 30 to 35? Why? It's the amount of time it takes, energy, and the amount of time it takes to make one cell. That would be the reason. So you're beginning to see now how these numbers fit into to express the degrees of health by your biological terms. Is that clear to you? Is there, now in the second case, you would have 6 over 4, it means they have a potassium deficiency. Regardless of their age, they have a potassium deficiency. You may go to the doctor and you say you don't have a potassium deficiency. You're still in the average range. Blood changes so rapidly you can't keep up with it, but the urine analysis is more accurate than blood analysis when it comes to potassium. The blood analysis is temporary. The urinary analysis is more permanent because you're dealing in a number of hours, or in the blood chemistry you're dealing in a matter of minutes. So these are factors you need to keep in mind on conditions of body chemistry change, and it's time for a break.
We were talking yesterday about a few eyes and things that you had to look at and things that you had to watch for relative to the sclera of the eye, and we've got a bunch more to go, so we might as well get these things out of the way at this time to the best of our ability. The next one up that we had not talked about yesterday is the porcelain eye. The porcelain eye. It is almost porcelain egg white in color, which, as you know, is not really white at all. It is an off-white, but the eye just looks like it's just made out of porcelain. There's absolutely no vessels whatsoever. Okay, two things can be established from this. One, either they have a fantastic constitution, or two, if the numbers go along with it, and which usually they will, they're nearing death. Now, a strange thing is that porcelain eyes, once in a while, will show up in very, very severe diabetics. And what appears to be happening is that the body has just gone as far as it's going to go, and it is starting to back off. Of course, you can see the porcelain eyes also in the later stages of death, frequently from cancer. You can see the porcelain eye very, very frequently in mental patients also, people who have had brain damage, stuff of this nature, because evidently the ability of the brain to communicate with the outside world through the eye has been detoured or damaged. So you can see them scattered around in various different places. when you see them, primarily the thing to consider is the fact that there is a good possibility that they are in grave states as far as their body physiology and constitution is concerned. Now the next eye to look for is the bluish eye. A bluish eye. Now, for some of you, I'm going to say something that will confuse you, but you can look it up in the dictionary or something. There is a condition called osteogenesis imperfecti, in which the sclera is blue. It's one of the pathognomonic signs of it. But this particular person has very poorly formed bones that break very, very easily or have broken, and these people are usually pretty badly deformed. So if you see a blue eye in them, of course, you know what you're dealing with. But there are blue eyes, there are bluish eyes that you see with a regular vascular pattern, whether it be normal or you can even see some of the other patterns overlaying them. You have to be aware of, when you're looking at this sclera, to note its color, because this bluish eye has a strange kind of a connotation. It denotes sex organ problems. Therefore, in the male, it denotes the fact that the the prostate may not in fact be up to snuff. And in the women, it very frequently appears in women who are having uterine problems or uterus ovary problems. And you watch for this bluish cast to the sclera. And you'll usually find a lot of stress on these people, and on these people as far as their individual sexual related organs are concerned. So watch for this bluish eye. Now, it's pretty hard to see if there's a lot of other activity, so make certain now that you watch for it very closely. Now, on occasion, you will find bluish spots on the eye. There will be small little areas on the sclera, little circumscribed areas of blue scattered here, there, or yon on the sclera. When you see these little bluish spots on the sclera, then you want to consider splenic toxicity. In other words, the spleen is being hit with more than it can handle. Either it is deficient due to mineralization, or there is so many damaged cells, delta cells, coursing through the bloodstream that it is trying to clear out of the system and break down effectively. Or it may be a factor that the blood picture is very poor, a lot of blood cells are damaged, and the spleen is trying to take those out of circulation, that it becomes highly toxic. And when it becomes toxic, you begin to see these little bluish spots show up on the eye. And you have to watch for these too, because sometimes you will have a vascular, would you brew up one? You will see these little bluish spots, but there may be other vascular activity all around this particular area. And if you're not careful with what you're looking at, very frequently you may miss the blue spot because of the fact that it is disturbed. Now, these charts that I handed out to you were for you to take and draw on. They weren't to take home and, to draw vessels on when you get home. They're to draw some of the patterns on and then label them off to the side and then take notes. And some of you aren't, and I think that may be a mistake, because it's very, very good if you draw these patterns on as I have been covering them with you. And especially when we get into the right and the left eye individually, it's going to be very important that you draw these patterns in then. Now, another thing that we have to take into consideration is either yellowish or brownish yellowish spots on the sclera. This is the next thing we have to look at. And they'll look basically about the same way as the splenic spots, only they're yellow or they're a brownish yellow. No, just spots on the sclera, okay, that you can see, areas of discoloration on the sclera. Now, these are hard to see too, because these bluish spots and brownish yellow spots tend to kind of fade into the color of the sclera, and very, very frequently you'll see a lot of vascular activity around a given area, and there that spot lays in there, and you're just used to seeing the red vessels all around, and you just think that you're seeing just sort of a blending outward of this color, and you don't really stop to consider the fact that laying in around this activity there's actually a yellowish spot, or that there is a yellowish brown spot laying in there. And they blend out, taper out into the rest of the sclera. Whenever you see these in here, note that you have got a very, very, very toxic liver. Now, of course, the next step is... Okay. Tape 8. Turning over. Tape 8.
Now is the time to turn tape over. Praise the wonderful name of Jesus. Hallelujah.